This picture is being sent all over social media, and someone sent it to me asking what is going on with this person's back. Well, first off, you can tell that there's some sort of foreign object sticking out of this person's back through their skin. But you can also see the shape of a similar object on the opposite side. Now, I remember this actually happening during residency. There was a person that came in from another hospital after having this type of surgery, and their hardware was sticking out through their skin. That is titanium hardware used to fixate the spine. This person has what's called posterior instrumented fixation, where this is the back part of the spine. You can see that there are screws that go into the vertebral body, and we put this metal rod directly in the center of it, and that will keep everything nice and firm and fixated, and over time it will fuse. But as you can tell, that hardware is kind of proud, and it sticks out over the rest of the bony elements. When somebody is pretty thin and they don't have very big musculature over that area to cover the hardware, it can sometimes wear through that tissue and start sticking out of the skin. Now, it's extremely rare that something like this would happen, and we typically try to avoid doing this in somebody that is malnourished exactly for this reason. So we had to call plastic surgery, and plastic surgery did what's called a muscle flap, where they took muscle tissue from surrounding area and were able to adjust it in such a way to reconstruct that area. And that way it can cover the hardware without sticking through the skin. Extremely sad situation. I really hope she gets the care she needs.